I had a patient yesterday that came in. I gave her the suggestions for training. She had done this before. She's 49, and I said that the bottom line with what I found as far as good metabolism, but elevated cholesterol, elevated fat percent, and BMI was that we go into zone training. And zone training, if you don't know about it, is basically targeted at 180 minus your age. It hurts when you go up to very fast heart rates. It's hard to breathe. That's how you have to modulate your training. You don't have to hit those goals, but it's just a suggestion. Do I ever attain 140 to 150 and sustain it for 30 minutes? No, I don't. I try to. I'll always use that as a goal to pull me forward. And it's usually going to be cardiovascular, running, cycling, rowing, or HIIT training. That's the suggestion. And do you have to hit those numbers exactly? No. But if you don't have a goal, what are you supposed to do? Most of us become very efficient with what and how we run and exercise. And the idea would be with efficiency, your expenditure goes down. So some of us will think perceived exertion will be, I'm working out aggressively, when in actuality you're not burning the calories, you're not producing the stress to the body that it needs to maintain and get better. If you look at population aging usually is associated with sarcopenia and weakness. That weakness and arthritis comes because of difficulty with controlling joints, and then muscle weakness, muscle shrinking, muscle atrophy, that's sarcopenia. You've heard of osteopenia, osteoporosis, that's when bone gets brittle and thin. Well, muscle does the same thing. Typical picture of aging is a bent over person like this that is emaciated, can't move that fast because has no endurance and has no power to even put their suitcases overhead. With sarcopenia, with aging comes every disease in the world, and it's usually going to be heart attack, cancer, stroke, dementia. All in all, my suggestion is don't wait until you have those diseases and consider investing in your exercise now. So we're going to start this race now. I'll have you go through and I'll talk to you as I go. Think about the three types of muscle fibers. There's type 1, type 2. 2 is divided into A, B, and X. So type 1 it uses fat as its fuel. That's why I suggest using the zone 2 training. Zone 5, once a week. So those muscles are explosive, and they're different than the type 1s. And the muscle fibers for explosive are usually considered type 2s. They're divided into 2A, 2B, and 2X, but you don't have to worry about that. Just remember, type 1 fibers, cardiovascular fitness. Type 2 fibers, power, explosiveness. And I think you need both, because the type 2s, the power, explosiveness ones, they do need to have fast fuel, and fuel can't be fat. So type 2 fibers usually go for glycogen immediately. Glycogen, glucose, immediately available. You can burst, and it's also important to have 1s, and that's endurance. Even in the form of a calf muscle. For prolonged standing, you need soleus muscles to be able to do that for a long time. You also need to run away or move or climb up a ladder, and that's the gastroc, the two big heads on the calf. That's type 2. So it's important to have both, and you will have both, but if you don't exercise at all, everything will shrink, everything will divert to 1. You'll keep the other fibers as hybrids, then they'll wait for the signal to grow. If you choose not to do anything and you just do, say, type 1s because you're a runner, cyclist, and you have good cardiovascular fitness, but you have limited power and explosiveness, well, that's cool, but I think with the type 2 development, you have more bulk. The more bulk you have, the more you can dispose of glucose out of the bloodstream and keep from becoming a diabetic. So I really believe that fatter fibers, the less your possibility for diabetes, dementia, cholesterol elevation, and heart attack. So we started the race, and the level of training I told you about, I'm trying to hit, is zone 2. Zone 2 can be measured by heart rate current heart rate is, whoa, 144, shoot. So, good point. But you can either follow your heart rate or you figure out your perceived exertion. RPE, or relative perceived exertion, can be a pretty good determinant for how much energy you're expending. And again, if I wanted to maintain zone 2, it really should be slowed down. Okay, halfway through this 5K and heart rate's at 150. So I've decided I'm going to turn this into my zone 5 workout. So thank you. The zone 5 should be 220 minus your age. That's a rough estimate. Also known as VO2 max. But short of getting the VO2 max test, that's a stress test. And I like the guys that Live Lean RX in Warrenville, or for those of you in Chicago, that'd be fine too. They have a few places like in Atlanta and other states, but you can get a VO2 max through their stress test, or you can use the old formula of heart rate. But bottom line is that if I'm supposed to be doing zone 5 20% of my week, I'm done. As long as I can maintain my heart rate for the next mile, 0.6. Looks like that's it. Finish line. Pulled a muscle at about 2 miles 6. Right soleus isn't used to running. So hopefully I'll recover with an ice bath. 32:03.
Dr. Rick from Bartlett.
Okay, done. So I guess the question is, why didn't do this? And yeah, my calf is killing me. I did not run this fast. I was doing these routines on Morpheus, which is I'm wearing this strap. That's a very accurate heart strap. And then this thing. When I hit a summit of muscle strength and I'm able to tolerate just a drop in 5K, 8K, 1,300 foot ascent for a mountain in Colorado. When I can do all that, maybe even attend a CrossFit session, rest assured I've built up enough strength, I have enough muscle, bank account is full. If you wait until you're 70 and you try to grow muscle, it's still doable, but it just takes an army of people and a boatload of time to wait for the results. If you are still in your 30s and 40s, I highly suggest you do this now. If you're in your 50s, yeah, just be careful, because I've probably diagnosed you with medical disease. With medicines, probably, or nutrition, which is very important. And then we move forward, get you exercising, get you eating properly, have you measuring sleep, like all these things. And then hopefully some point in time in the future, and everybody's a little different, there's no formula. Some point in time in the future, we have cruising altitude so that everything's humming. Your numbers are okay, your blood pressure's good, you feel good, and then we can start pulling things off. So that's my integrative medicine approach to taking care of patients, no matter what age. Nobody's perfect, everybody's got medical problems, but one thing's for sure, everybody dies. So if we can get you to die at 100, that's cool. If you die early, at 60, 70, unfair to your family. If you die 70, 80, but you've got disability, that's not cool either, because you still have to depend on your family. So that's why I push so hard. So that patient of mine who said that she is probably not going to want to hit zone 5 for long, she'll do it for me, but then unsustainable. I say that once you taste success, that it will be easily sustainable. Plus, I don't just have one formula. I usually periodize. I change the formulas up every 3 months to 4 months in Chicago to go with the seasons, because we need variety. So thanks for watching. If you know anybody that can use some help and they're just bathed with medications and their doctor just gives them pill after pill after pill, send them my way. Herbal411 is my website. I have a practice in Hoffman Estates for in-persons. Then I have a virtual practice where I see patients from around the world. So thanks for watching us at this point in time. Stay healthy, get outside and do something.